Hi, everyone. So my name is Shonna Yin. I'm a general pediatrician and an associate professor of pediatrics and population health at NYU. And I'm excited to be part of this Reactor Panel. For the past 10 years, I've worked as a general pediatrician at Bellevue Hospital, which is a flagship hospital in the New York City public hospital system. And the families I serve are predominantly low-income, immigrant families who struggle with issues of health literacy and language. And I've seen firsthand the challenges that parents face in trying to administer medication safely to their kids. I'm also a researcher, as many of you know. My research focuses on the intersection between health literacy and medication safety. I work on designing and evaluating health literacy-informed intervention tools to improve communication between providers and families. And I'm a PI of an R01 funded by NICHD to try to redesign the medication label for pediatric liquid medicines, thinking about issues around metric dosing and also around dosing tools, et cetera. So as I have been sitting and listening to the presentations today, one of the issues that really is at the forefront of my mind is this issue of dissemination and large-scale implementation. I was excited to really see those real-world changes that have been going on at the pharmacy level in Wisconsin, at the industry level at Merck, and through integration in healthcare systems with Project Red and the polyglot education work from Charles. And each of these groups is really tackling an important piece of the problem. But what worries me is, how do we get from where we are now, where there are a few institutions and few organizations implementing these positive changes, to where we want to be, where all the patients are able to receive information that's understandable? Is it really necessary for us to go state by state? Like in Wisconsin, I love what you're doing there, where you've really rigorously approached this and tackled this issue, assessed barriers and facilitators, had this advisory council, have patient feedback and input. Do we expect this to happen every state? We have to battle this every state. It seems like a really daunting process that'll take us decades before everybody has a low literacy labels. How can we better engage large chain pharmacies that span across states to try to get them to adopt and lead by example? How can we get corporate buy-in and present a business case for health literacy informed labeling? And I wondered about the National Association of Boards of Pharmacy. Maybe you can comment on that and where they see themselves in trying to push this issue forward. And I'm excited to see what happens in Wisconsin. With the labeling summit that's going to happen in April, to see how you might be able to push this and make things move faster. Beyond the bottle labeling and thinking about the drug information included with the medications, I was really impressed by Merck and the commitment to tackle health literacy issues, how you've done that so thoughtfully and systematically, incorporating patients with low health literacy, using iterative patient feedback, doing the in-person research, I think is very important, and assessing health literacy itself and using the newest vital sign. And I was thinking about how we can get these best practices adopted by other drug manufacturers and whether the FDA might be able to recommend or push for certain more standards in terms of the testing of drug information. Could the FDA perhaps recommend some minimum number of low literate patients, for example, that medication information should be tested with? I'm not sure if that currently exists or not, but it sounds like Merck is trying to target 25% of the patients that they're testing materials with, and maybe that could be a goal, or even higher potentially, given that we know in the U.S. that more than half of people are struggling with health literacy issues. And I wondered about whether certain criteria could be established around thresholds for understanding. I know you're testing comprehension, and you're able to get to over 85%. It sounds like comprehension, even across all the different literacy levels. And I'd love to understand more about how comprehension is tested, et cetera, and how that could be adopted in other places. Hearing about Project Red, it's something that I've been following the progress over the years, and I've been really impressed by what's happening there. How they've rigorously approached this problem, how they've been able to establish the business case, the reduction in discharge in readmissions, and it's being adopted in many places, but I wish more adoption could happen, and I wonder what some of those barriers are that can be addressed that you've encountered in trying to get this integrated into EMR systems, et cetera, and how maybe Project Red could be expanded to beyond just the discharge process, but to regular outpatient encounters where medications are being managed, and ED settings when people are being sent home on medications, going beyond just the inpatient hospital transition process. Medication was it's a very promising tool and being linked to EMRs at many places we were talking earlier, but also hasn't been adopted on a larger scale. And I wonder how we can encourage health systems to adopt these interventions more universally, and what processes need to be in place to engage those large EMRs maybe as a start to get them to adopt these kinds of interventions more broadly. And I hope that we can speed up the process of adoption, and that in 5 years when we have another meeting like this, that I'd love to say that we've made a bigger leap. I know we're making these incremental changes, and it's not to say that I don't think that a lot has happened. I've been really impressed by how the IOM Roundtable has been able to push things forward. I was at the 2007 meeting, I think many of you guys were, and again at the 2010 meeting on the Safe Use Initiative. And now, we have these concrete recommendations on layout and content. We have these evidence-based interventions. We have the FDA trying to incorporate health literacy principles across their agency, but we don't have this widespread adoption that I'd love to see, and the widespread dissemination I'd like to see. And we haven't really explored how technology can be tapped to allow for adoption. I also, as other people mentioned earlier, haven't seen how we're going to be able to do this seamlessly. The digital interoperability, where patients who are receiving information from their doctor, from the pharmacy, that there's somehow coordinated, that the information presented is reinforcing of each other, supporting each other. There's cohesiveness in the messages, that information is accessed through a single source, a single patient portal, rather than distributed in a kind of a more fragmented manner like it is now. And we haven't really talked about how the information can be seamlessly also shared with family members and other caregivers that are involved in giving medications. In the presentation from Charles about language access, it's disappointing to me how often medication information is still not available in the language of the patient, and that the quality of translations is often so poor, and that there aren't a lot of system solutions that are out there. Could there be some sort of bank of information where well thought out translations of plain language wording, warnings, information could be housed centrally so that organizations could draw from them? And why is it that every organization, every health system, every EMR vendor, every manufacturer of patient information has to kind of tackle these issues in their individual silos? So I think, I think we all know this is complicated. There are no easy solutions. We need many stakeholders at the table, and I'm hopeful that we're going to be able to come up with a plan to move the field forward more quickly, and I'm excited to be here to hopefully brainstorm about next steps.